distinguished members on the dais, and ladies and gentlemen. I am really happy that Rajendra Gupta ji has written an insightful book on healthcare, which is being launched today. In fact, I was keenly looking forward to being present to launch the book and to interact with you. But somehow, due to some unavoidable reasons, I have to travel today. Thankfully, technology allows me to still be amongst you, and I am here to convey my thoughts. We all know that Indian healthcare system is at the stage where we need to innovate so that we can deliver affordable, accessible and accountable care to every citizen of this country. If we look at the history of the healthcare in India, which Rajendra ji has very well documented in his book, we will see that the challenges in the healthcare are historical and now they have become systemic, as well as in addition we have had these calamities and epidemics which have exerted additional load on the system. The challenges are quite visible, like there is a dual problem of shortage as well as unequal distribution of healthcare facilities. There is inequity in the delivery of healthcare across the nation, not just in terms of quantity but also quality. Majority of healthcare facilities are concentrated in just few towns. On one side, we have the challenge of gaps in infrastructure, and on the other side, we have the increasing burden of disease and our increasing population. There is a demographic shift. Not only the population is younger, there is a real challenge when the chronic diseases are now occurring at a much younger age. We have also to address the challenges that come with an aging nation, as we have already have a geriatric population in excess of 10 crore to look after. We have been witnessing the natural calamities and epidemic outbreaks which are occurring with increasing frequency and adds to our existing healthcare delivery burden. We have issues with regards to financing. We know that the majority of the healthcare spending is out of pocket. Most importantly, there is a problem of perception between the private and the public sector, and one of the biggest challenges I see is that of the lack of the trust, which is a result of multiple factors. I am an optimist and I see tremendous opportunity to transform the healthcare delivery system. With the focus of our Honorable Prime Minister in keeping up with the spirit of cooperative federalism, we have increased the central tax devolution to the states from 32 to 42%, which means that states will have more money to invest in healthcare going forward, and the states can spend money on the regional needs. In my view, though we have formidable challenges, but India has a unique advantage as well, and that is we have 65% of the population that is below 35 years of age. Our human resources in healthcare are amongst the best in the world. We have the time-tested traditional system of Ayurveda and yoga. We have the best technical manpower in the world. We have phenomenal capabilities with the private sector. Given the global learning at hand and the fact that we are still building our healthcare system, I am sure that we can set India class standards for the world rather than just copying world class standards to India. Our ministry is moving ahead with some major initiatives that are aimed at positively impacting the lives of the masses with a holistic approach. We have launched Mission Indradhanush to increase the full immunization coverage to 90% by 2020. India Newborn Action Plan launched to end the preventable newborn deaths and stillbirths to single digits by 2030. We have introduced new vaccines. IPV and adult JE vaccine has been launched. Rotavirus and MMR vaccines have been launched soon, will be launched soon. We have introduced injectable contraceptives to widen our offering in family planning program. 1 lakh additional patients have been brought under ART the third line treatment has been assured for HIV and AIDS patients. We have planned AIMS-like institutions in all states in a phased manner, and we will upgrade 70 medical colleges under PMSSY for development of super specialty wards. 20 cancer institutes and 50 tertiary cancer care centers are being. Health information is very critical and should be available from authentic sources. The National Health Portal is an initiative to address the gap. We are testing and deploying technology solutions to improve the access and delivery of services. 2 weeks ago, we launched the Kilkari program, and this will certainly help in addressing the issue of IMR and MMR. Kayakalp has been launched for Swachh Bharat Abhiyan. Amrit, affordable medicines and reliable implants for treatment, has been launched to provide affordable medicines which constitute a major in out-of-pocket spending. We are doing a massive skilling program in association with the Ministry of Skill Development to address the unmet needs in health care delivery and to create jobs. We are setting up a Center of Excellence for Aging. I believe that India offers opportunity in every sector, and healthcare has tremendous scope for not just investment improvement but also as a major job creator. I see that private sector is doing a lot healthcare delivery, and there is a tremendous scope for public private partnership. Within the ministry, we have set up a working group with private sector. There is a lot for us to work together and improve population health. I will stop here as I know that there are interesting speakers lined ahead for today evening. I am sure that you will enjoy the rest of the evening, and the book will make an interesting and meaningful read. I look forward to next opportunity to interact with you and apologize for not being able to come personally today. Enjoy the book launched by the evening ahead. My congratulations to Rajendra ji once again for the book. Thank you very much. Thank you. Sir, thank you.